Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. If you're a female athlete or have children or friends who are athletes or who just exercise a lot, you don't want to miss today's talk, where we delve into why this population may be at risk for osteoporosis and osteopenia and what can be done. The information we talk about is applicable to women of all ages. Our special guest is Dr. Jessica Drummond, who's a physical therapist and clinical nutritionist, and the founder of the Integrative Women's Health Institute. Jessica is passionate about helping female athletes and empowering women who struggle with chronic pelvic pain conditions and hormonal imbalances, as well as supporting women's health and wellness professionals globally. There are so many takeaways in today's talk, so I can't wait to share this with all of you. Welcome, Jessica. We met over a year ago, and we have so much in common that it's incredible. We're both physical therapists. We both have gone beyond and studied nutrition and wellness and incorporate that into all of our programs. And we even trained with similar people. So I could speak to you for hours, but you have so much amazing information that you're bringing to this community. And what I'm so excited about is that we're not just dealing with someone who has osteoporosis, who's in their 50s or their 60s, which is a lot of times what people think about osteoporosis, and they don't even get tested or even think it could be something that occurs much earlier. But what you're talking about is what the root cause might be, and something that can affect every person who's listening, whether it's for themselves, whether it's someone they know, or whether it's for one of their children, or it's just so important that I'm really excited about this topic, which is talking about osteoporosis, osteopenia, and the female athlete. And it even goes beyond. It's not just female athlete, but people who dancers and other people as well. So thank you for being here, and I'm really looking forward to our interview, probably as much as everyone who's listening. But let's start from the beginning, because a lot of people listening are probably thinking, wait a minute, osteoporosis, that's usually disuse. You know, we have to exercise to improve our bones. So this just doesn't make sense. It's counterintuitive that osteoporosis or osteopenia can have anything to do with someone who's an athlete and really exercises. So why don't you fill us in why these people might be at risk for osteoporosis and osteopenia?
Well, first of all, Margie, thanks so much for having me here today. And yes, it's my pleasure to be here. And we do have a lot of things in common, which is really fun. So when we think about osteopenia and osteoporosis, we tend to think about women in their 50s, 60s, really older, 70s, 80s. You know, we don't really start thinking about osteoporosis until at least the 50s in most cases. But the truth is that athletes and younger people in general are at risk for setting kind of a foundation that places them long-term at risk for osteoporosis because of a lack of nutrient foundation, if you will. So female athletes do exercise a lot, and in certain sports, they have that mechanical pounding on their bones that's actually beneficial for building bone strength and stability in the long term. But with high levels of training, and, you know, hey, I have 2 young daughters, and I know how tweens and teens eat right now, right? And on average, they're just not fueling that intense level of activity. Even at the elite level, there are studies done in collegiate athletes and elite athletes. They're not really fueling the nutrient absorption required to maintain that pretty intense level of training. And so the bones are one of the areas of the body that can suffer because they need this long-term building of a foundation of nutrient absorption. So that's one, just absolutely not necessarily taking in the amount of nutrients that they need. So, and it's not to say that people aren't getting enough calories. They might be getting enough calories, but not enough nutrient dense calories that are actually setting the mineral foundation and the amino acid foundation and the fatty acid foundation and all of these root nutrients that we need to build bones. And then second, even when younger women and teens and tweens are eating a healthy, nutrient-dense diet, we have lots and lots of people in this country with digestive challenges, with heartburn and bloating and, constipation and diarrhea. And if you're having digestive symptoms, which don't always look like GI symptoms, sometimes it could be things like skin breakouts, acne. We can have problems with digestion that don't necessarily show up as digestive symptoms. But if we're seeing digestive symptoms, which in the vast majority of cases we do see, even though your client might be eating just a great, lovely, delicious diet, they may not be absorbing all of those nutrients because of a lack of optimal function in the digestive system.
I love that. And that's so true, because so many times people think, we're not what we eat, but it's what we absorb. So that's such a good point. And a lot of people just think that's normal, having, a little stomach issue here, a little constipation. I don't go for a few days, but none of that is. So I think that's wonderful that you brought that up. But why don't you explain a little bit about, because we used to think it's just the triad. It was amenorrhea, osteoporosis, and eating disorders. That's what it used to be thought of. And a lot of people are familiar with that concept, but now it's gone beyond that, something called REDS, which is relative energy deficiency in sport. And that's really an interesting topic. And why don't you shed some light on how that fits in with this whole conversation?
Yeah, so we've used the term female athlete triad for as long as I've been in practice, which is about 20 years now. And essentially, that's the definition is exactly what you're saying. Disordered eating in combination with amenorrhea or oligomenorrhea, which is either skipping periods or having irregular periods in combination with osteopenia. And what we've realized is that, in a sense, female athlete triad like that, those three issues coming together is the tip of the iceberg of what's really going on systemically. So now that syndrome and other things that are associated with it have been renamed by the International Olympic Committee in 2014 as relative energy deficiency in sport. So as I just mentioned, athletes, teen and tween athletes, collegiate athletes, high school athletes. And I actually think of women in their 30s and 40s who have 2 small kids, a full-time job, and hit, a couple of boot camp and spinning classes and yoga classes a week. They're athletes too, right?
Yes, they are.
From an energy output standpoint for sure. So REDS talks about this imbalance between energy in, so how much actually caloric nutrition you're getting. Like, are you getting adequate? Are you eating enough at a very basic level? And then versus energy out. So if you're just exercising like crazy, my daughter plays high school volleyball. She gets up at about 5:45. She's at school from like 7 something until 2 o'clock, 2:30. Then she's at practice for 2 hours. Then sometimes they have games after that. Last night we were like running from like 5:45 a.m. to about, and then I taught last night. So I was up until about 10:30 teaching. So both of us, there was a lot of energy out, right? So fueling even just a crazy day like that, and they're not all like that. We certainly want to be sure we're building in recovery, but even high school athletes, but certainly at the elite level, at the collegiate level, you're carrying a study load, you're working out sometimes like 15 to 20 to 25 hours per week, that you need enough just calories to fuel that. And that's the first imbalance that they're talking about in relative energy deficiency in sport. And then what I like to also add to that conversation is that those calories have to not just be calorically dense. We don't want just all these athletes to be fueling themselves with, pizza and cake and, soda or whatever, because there are very caloric dense foods that are not nutrient dense. And for all of the systems, so when we talk about someone having REDS, they're not getting the nutrition that they need relative to the energy output that they're putting out to optimize the health of all their physiologic systems, their digestive system, their neurologic system, their musculoskeletal growth and building, their hormone balance. And when you don't have the nutrition that you need, not just from a calorie standpoint, but also from a nutrient standpoint, you need tons of fatty acids to build hormones. You need tons of fatty acids to build neuronal connections. You need zinc to keep restoring the lining of your digestive system. You need magnesium to have appropriate bowel movements. You need magnesium, calcium, and potassium to build bone, right? So we need foods that provide us with not just calories, but micronutrients like vitamins and minerals, fatty acids, which come from fats. So we don't want to be fat aversive, especially if we're working out really heavily. Carbohydrates, primarily in the form of vegetables, because that also will give us the phytonutrients. Even the general recommendations from the World Health Association recommend that people have 8 to 10 servings of vegetables a day. In America, we changed it to 5 just because our public health people don't think we can hit 8 to 10. We're like, we're lucky if we can get them to eat 5, right? So a lot of times we're worried about people eating too much for gaining weight. But the problem is when people have very active lifestyles, they actually have to fuel those lifestyles with very nutrient-dense foods, vegetables, healthy fats, high-quality proteins, on a pretty consistent basis. Otherwise, you're just not going to have the building blocks that you need to keep all your systems functioning optimally. And then you end up, the women in their 30s and 40s having brain fog and at work, and girls who are overtraining in their sport, they lose their menstrual cycle. They begin to have, breakdown of healthy muscle rather than fat. So we really need to fuel these very active endeavors.
And this is where the beginnings of osteopenia and bone loss start. So it's something that people can affect right away, early on. Nip it. It's sort of, we develop our bones and they're younger. It's sort of like a bank. We keep putting deposits. But if we're taking away and we're not giving the nutrients to develop, it's something that is really relatively easy to stop at an early age and can have absolutely profound effects on our bones later on. One thing I just wanted to talk about that you mentioned was fat, because I see this with women all the time. There was a generation that they were just so afraid of fat, and fat was the culprit, and fat was the cause of everything. And it was just vilified. And so, but vitamins A, D, E, and K, which are so important for our bones, are fat soluble. Mm-hmm. So we absolutely need the fat to be absorbed. And so it's very important that that's one of the components of all the healthy components that you mentioned. But
yeah, and I would say that fat is essential for building estrogen as well. And we can't mineralize optimally our bones without adequate estrogen as well.
Yeah, great point. So now we have the athletes. The other thing that happens with athletes often is that they get fractures. Mm-hmm. And so what can we do? Is there things that we can nutritionally do to help them heal quicker? Because we all want to get them better, get right back into your sport. But
right. Just hopping right back to sport as fast as possible. So I do that with essentially providing the nutrition that rebuilds bone. And you just mentioned some of those things. So bone is made of a lot of micronutrients, which are vitamins and minerals, vitamin A, vitamin D, vitamin K. Vitamin D and K help us to actually shuttle the calcium that we're eating into the bones rather than having it store in the vessels, which can be problematic. Calcium, magnesium, potassium, protein, and fat to help kind of support the absorption of those nutrients and the hormones that you need. So if someone has a fracture, you can be like, oh, just, cast it, go home, eat McDonald's. It'll be better in about 6 weeks, right?
Typically what's done. No one is really saying your nutrition matters more than ever at this point.
Yeah. But imagine if we cast it, we're immobilizing it. We're also keeping the rest of our body moving. So we've got good nutrition, good circulation to the area, good sort of cellular nutrition, good circulation. And then instead of, sitting on the couch with our casted leg up and eating fast food, we're having like protein dense smoothies and blended soups that are filled with vegetables of all colors. We're getting outside and getting some sunlight exposure. Even if we can't do a lot of outdoor workouts, we could just be out walking with crutches or out just sitting and breathing in the sun, getting that vitamin D exposure. So in that case, I'm again really making sure that the clients are hitting the basics. We're getting 8 to 10 servings of vegetables a day, particularly if they're having any digestive issues, which, if someone has this fracture because there was an accident or something and they're on antibiotics or they're on any kind of medication that's irritating the stomach, then we would I love blended soups for just getting tons and tons of nutrients in. You can use homemade bone broths. You can saute some vegetables, put it all in a big pot, slowly cook it, and just put an immersion blender in there. That's really helpful for nutrient absorption. I like protein smoothies for nutrient absorption. Add some berries, which are very phytonutrient dense. I like adding zinc and other nutrients that help with the digestive system to actually absorb the nutrition. Probiotics and digestive enzymes can also help with nutrient absorption, as can, if a person is pretty healthy other than the fracture, just taking a little bit of apple cider vinegar and a little bit of water at the beginning of each meal can help improve their ability to really digest protein. So that can be helpful. If they tend to run low with stomach acid, protein needs a very acidic environment. Animal protein needs an acidic environment in the stomach to be really broken down so we can use it. And then my other important tip for kind of recovering from injury and making sure we're really getting nutrient absorption is, do you know how many times it's evidence-based to actually chew a bite of food, especially if we're talking about like a plate of steak and vegetables, to really get the nutrition out of it? How many times do we need to chew a bite of that?
Yeah.
Do you know? Do you know what the number is? Let's just throw it out.
I think it's 30 at least.
Close. Yeah, it's 40.
Yeah.
None of us do that, right? You could affect your bones simply by slowing down and really chewing that food. That's why I like blended soups and smoothies when we're talking about injury recovery, because the cooking method actually helps facilitate the absorption.
But Jessica, that's what I love. There's easy tweaks that everybody can do to really change their life. I have found slowing down and chewing completely can transform people's lives. Something as simple, they'll lose weight for people who don't want to lose weight, but also that you're going to absorb. People don't realize just shoving the food in. And I know when I first was working as a physical therapist only and seeing so many patients, this was early on in my career, I was the worst offender, shoving the food in as fast as physically possible so I could get to the next patient. And I don't do anything like that, but that could majorly affect your digestion and what you're absorbing, and ultimately every part of your body and every part of your nutrition and your bones, your brain, everything. So a simple thing, you can leave this talk and just start as best you can chewing your food, and you'll make a difference in what you're absorbing. So that's
Absolutely.
great. I love all those tips and all the information because it's something we can all put to use right away. And the other thing that I know that you talk about a lot is people should work in conjunction and alignment with their menstrual cycle. And that's going to make a big difference for them being at risk for osteopenia and bone issues, as well as the REDs. So why don't you maybe go into that a little bit?
Yeah, I don't think we're taught nearly enough about our menstrual cycle at puberty. I think we're taught to sort of fear it and, stay away from sex. Like that's pretty much it, right? You're going to get your period. It's going to be terrible. Watch out. No, I think of the menstrual cycle for women, as especially female athletes, as really a superpower, but also for those very active and athletic teenagers and adult women, because there are different times in the cycle when different strengths of ours are supported. So just to give you a little tutorial, because you probably didn't get this in like fourth grade sex ed. So day one of your menstrual cycle is the day that you start bleeding for your period. At that time, the first couple of days of the menstrual cycle, our estrogen, progesterone, and testosterone levels are pretty low. They're at their relative lowest for the month. And so this is a time for recovery. Those hormones being at relatively low levels, we're designed to take a little bit of a break. So especially for athletes, now you can't always time your competitions and you can't always time your big presentations at work. You can't always time the SATs around, your menstrual cycle. But if you can, you want to be having those rest and recovery days where you're eating more of that easily digestible nutrition, you're hydrating, you're doing slow flow kinds of yoga practices, you're sleeping more, you're giving yourself a couple of days of like restorative recovery, active recovery, if you will. No matter how old you are. And if you can't, if it's like literally the day of the Olympics or, your big interview or you've got to defend your PhD dissertation, right? It's like day one of your period. Well, then you take really extra special care of your nutrition, no sugar, no alcohol, go to bed early the night before, have everybody else help you with your kids and extra homework, like buffer yourself to be able to give your full energy and attention to the thing that's most important on that day and really support it nutritionally and with support of others. Then as we transition to about day 4, 5, 6 of the menstrual cycle, and this varies a bit from person to person, your estrogen and testosterone levels increase. Progesterone goes up a little bit, but that stays relatively low during the whole first half of the cycle. So as your estrogen and testosterone levels increase towards ovulation, a couple of key things happen. One, your body preferentially burns fat, especially if you don't feed it too much sugar. So one of the first things you can do to just optimize your bone health and your menstrual health, which are very intricately related, is to eat absolutely a lot less sugar. We know that women who have PMS eat approximately, I think it's 245% more sugar than the women who don't have PMS. So less is more when it comes to sugar, but especially around that week and a half or so before you ovulate, your body ideally would like to preferentially burn fat. So this is when we want to be sure we're getting at least 30, 35%, maybe even 40% of our nutrition as healthy fats. Things like avocado, olive oil, nuts and seeds, fatty fishes like salmon, things like that. And if you don't have a dairy sensitivity, you could use something like grass-fed butter or yogurts, plain yogurts, things like that. And so this is a time where the body will preferentially burn fuel as fat. So we want to support it with fat and not too much sugar. Now you're still eating vegetables and protein, but make sure you're getting plenty of fat. And this is the time when it's going to be simplest to exercise most intensely. So to support the bones at this time, this is a great time to kind of push the limits, your personal limits, of like how heavy your strength training, for example. It's time to increase the weight a little bit. It's time to do a couple more reps. It's time to increase the intensity so that we're loading our bones with more pounding, more strength training, and this doesn't have to be hundreds and hundreds of pounds. If you're going from 5 pounds to 8 pounds, that's still a big shift. It's still a big improvement. And then maybe the next cycle, you're able to move from 8 pounds to 9 or 10 pounds, and every month or two, if you're slowly increasing the amount of strength training you can do, maybe how high you can jump, like if you're doing box jumps or jumping jacks or, any kind of exercise that either does some kind of resisted pounding or strength training where you're actually lifting weights or bands or things like that is good for your bones. And this week and a half during your cycle is when you want to increase the resistance and increase the intensity. Then as you move into the second half of the cycle, the luteal phase, progesterone dominates. I like to, from a training standpoint, essentially kind of maintain the gains that happen at this point, kind of just steadily, if you moved up from that 5 pounds to 8 pounds for the next week and a half, stick to 8 pounds, kind of solidify the gains. You don't have to just stop, but we don't want to push this on a steady incline. We need time to kind of adapt the system to that new improvement. And then in the luteal phase, as progesterone dominates, the body preferentially uses protein. So here, where we're kind of solidifying our muscular and bone gains, we want to be sure we're eating adequate protein, which could be as much as about 1.5 to 2 grams per kilogram of your body weight each day. So this could be protein smoothies, this can be organic poultry, this can be fatty fishes or any kind of fish. This can be vegetarian proteins like seeds and beans. However you get your protein, this is a time to really focus on that. And then we move back into kind of the last couple of days of the cycle where all the hormones are down again, just before your bleeding time starts. And again, a new cycle of recovery, restoration, easy digestible foods, and sort of an active recovery.
Oh, I love this, because most people, and I'm sure most of the women that you see, really don't even think in these terms at all, that we could use our cycle to really help us maximally. First of all, it will improve everything, and as well as, our performance, but also our overall health. And what Jessica's saying with the bones, if we start young and we're getting the bones respond to the forces placed upon it. So if we're getting forces on our bones at a young age and throughout life, we're going to significantly reduce our risk of osteoporosis and osteopenia and have strong bones throughout life. So it starts here. So everything you're saying is so important. And as you said, it doesn't just affect the athletes. It affects people doing sports, doing recreational dancing, doing everything, who are really working themselves at a certain level. So I just think this is just wonderful. And what about for a girl who's just getting her period, or if it's somebody's daughter, what would you tell them? What's our best way to start to educate and train them so that they don't sacrifice their health?
Well, I think just teaching them about the cyclical nature of a woman's hormonal health and how to support that through the cycle. The earlier girls and women can learn that, and just the idea that, we don't need to limit too strictly, especially in young girls who are healthy, the foods that they're eating, but we want to be sure they're adding those nutrient dense foods, right? So if they are going to have a volleyball pizza party, like, great, but let's also have vegetables there, or let's have protein, and berry smoothie in the morning. Like, we want to be adding the positive nutrition from the very beginning. And I think it's not ideal unless there's a particular health reason to really limit the kinds of foods that teenage girls eat, because eating disorder is a much more serious problem in that age group than just relaxing through those 10 years of kind of puberty transition and teaching girls to eat more and more and more healthy food, rather than being like, don't eat that and don't eat this and this is scary and this is dangerous. only if there's a really particular health reason do I avoid any kinds of foods in teenagers. I think it's much more important to focus on adding nutrient-dense foods. And then I think just teaching them about the cyclical nature of their menstrual cycle and that it takes about a month, and there are built-in times of restorative recovery. And I think it's also important and kind of interesting to note that boys and men have cyclical cycles as well. They're just every day, not every month. And so they align more with like a traditional workday. Their hormones are highest around 7 to 7:45 in the morning. They drop off kind of mid to late afternoon. And so kind of the day-to-day workday schedule that we've created in this life is based much more on a male cycle than on a female cycle. So we need to just understand that so we can adapt.
That's really great. And another thing, men also get osteoporosis, and this REDS also occurs
Yes.
in men as well. So all these things do apply. It's really interesting, as you said. So my daughter played competitive tennis, and my sons played ice hockey and different things. But what was asked for the parents, bring the Gatorade, bring the snacks. And and I didn't. I changed it to coconut water, or, there's a lot of different healthier snacks. But I think once they start eating healthy, they feel better, because most people don't realize there's such a difference. And as you said, sugar is such a huge culprit, and it's addictive. So it's something that, and you can't just all of a sudden say, okay, it's this part of my menstrual cycle, I'm not going to have sugar. You have to really make a concerted effort at all parts of your life to minimize sugar. And slowly, it depends. Certain people do it different ways, but I have found that's probably one of the biggest game changers. I don't know if you agree, when people reduce sugar. I know personally, I'm a recovered sugar addict. And so it was amazing when I just gave up sugar and the difference. And now, even if I have a little bit, I feel awful. My strength is reduced. And there's just, we know, so many negative health consequences. And for the bones, it reduces absorption of the nutrients. It just goes on and on. So I'm so glad that you brought that up. But that's something everyone on this who's listening can start with, just as you said, not to restrict, because we certainly don't want all the psychological implications, but I love how you just said, add all the positive. That's so great. But I want you to tell us, because you have created, I have to say, Jessica has done so many great things. It's really amazing. And it makes me happy, because as a fellow physical therapist, you've gone beyond and just done so much with so much additional training, and really that you created things that are going to, I believe, change bone health, which is what I'm so interested in, but really can change the world. So yay you. But
Thank you.
Your program that really is very applicable to people listening. You have a program for really basically, it's called the Female Athlete Wellness Program. But this is for trainers. It's for nutritionists. It's for health coaches. It's for doctors. It's for anyone who's working with female athletes, or whether it's even female dancers or females. Right?
Yeah.
And why don't you just tell us a little bit about this program? Because, education is where it all starts. In this 40-minute talk, we can only cover so much, but there's a way that through this, we can help our young people so that they don't injure themselves. They have strong bones for life and really are healthy for life. It goes much bigger. It's a much bigger issue than just the bones. So why don't you tell us a little bit about this exciting program?
Yeah, so the Female Athlete Wellness Program is a professional education program for health and wellness professionals, physical therapists, fitness professionals, strength and conditioning coaches, volleyball coaches, and if parents want to join in and watch it, or if you want to watch it for yourself, it's a great program. It's just at a kind of a science-y level. But I created this for everyone working with female athletes who want to help optimize their nutrition and training in a way that thinks of girls and women as girls and women. Because at the end of the day, we can do a lot of very comparable things from a physical standpoint to men and male athletes, but how we approach it is distinct. And I think we need to understand that, women at the end of the day are not small men when it comes to training and optimizing their athletic performance. And there's a little bit of a difference between performance and health. So I want people to pay attention to that. We can be optimizing performance in a way that's not necessarily optimally healthy. And so in this program, we try to point out both.
That's just great. So if you're listening and you have a child who's an athlete, anyone who's working with them, it could really benefit from this program. And I love the part that it's for women, and we're not trying to scare them, because we all know with our children, it's not what you're telling them, it's how you say it. And if they're going to, you can tell them until you're blue in the face, stop the sugar, it's going to affect your performance, but it's not exactly that. So in this program, it's given in such a way, the knowledge that the people working with them can sort of, it can sort of relate it in a way that they will accept, and it will be in their language. So I just love that. I'm going to have all the links for that below and afterwards. And so you can certainly look into that for those of you who think that could benefit you, your children, or someone else. But I could talk to you for such a long time because there's so much to go over, but this has been so helpful. And what I love and what I'm trying to help bring to the world is that with bone health, it's something at all ages that we need to deal with. And so, and just like so many things, we want to get to the root cause. And if we can get to the root cause early on and keep people healthy and keep their bones strong, we're just really doing a lot of good in the world. So thank you so much. And
thank you.
I look forward to, we stay in touch and continue all the great things you're doing, and look forward to lots more in the future. But thank you so much for taking the time out of your busy schedule to be here with us today.
Thank you so much. It's been my pleasure.
Bye, everyone. I hope you enjoyed today's talk as much as I did. All the links are in the show notes. And I think it's so important to spread and share this information with anyone you think could benefit, because female athletes of all ages are at risk for osteoporosis, osteopenia, bone loss, and there's so much we can do to prevent this. So please share this, and I look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.